The broken American healthcare system versus universal healthcare. America is home to some of the best medical technologies and highly trained doctors. But when it comes to healthcare access and affordability, it's a different story. Today, we're breaking down why the U.S. for-profit healthcare system is failing its people and how a universal healthcare system could change everything for less money and better results. The American healthcare crisis. The U.S. spends more on healthcare than any other country, about $4.3 trillion in 2022. That's nearly 20% of the entire GDP. Yet, we have some of the worst health outcomes among developed nations. Take a look at this. Giving birth in the U.S., the average cost is $18,865 with complications. In Germany, it's around $2,500, and it's fully covered under their universal system. An MRI scan? $1,119 in the U.S., compared to $200 in Australia. Americans also pay outrageously high drug prices. A year's supply of insulin costs $6,000 in the U.S., while in Canada, it's just $600. That's 10 times more. It's no wonder 1 in 4 diabetics in America ration insulin, putting their lives at risk. The inhumanity of a for-profit system. Let's talk about what this means for everyday people. Here are just a few examples of how the for-profit system harms Americans. A 7-year-old boy was denied coverage for a life-saving heart surgery because the insurance company called it experimental. His parents had to crowdfund $300,000 to save his life. A single mother skipped chemotherapy treatments because her $7,000 deductible made it impossible to afford. She died months later. In 2023, 500,000 families declared bankruptcy due to medical bills. Imagine losing your home because you got sick. Even those who do have insurance aren't safe. Surprise medical bills are common. You might go to an in-network hospital, but an out-of-network anesthesiologist could leave you with a $10,000 bill. The system is designed to trap people in debt. How universal healthcare works. Now, let's imagine a different system. One where no one fears going to the doctor because of cost. Universal healthcare systems, like in Canada or Sweden, guarantee that everyone has access to care. It's funded through taxes, but here's the thing. The overall cost is much lower than what Americans currently pay. In countries with universal health care, more people access preventative care. This means diseases like cancer and diabetes are caught earlier, leading to better outcomes and lower costs overall. In the U.S., many skip these essential checkups because they can't afford the copays. And unlike the U.S., countries with universal systems have no medical bankruptcies. Imagine the peace of mind knowing that no matter what happens, you're covered. Better outcomes, longer lives. Despite all the money the U.S. spends, health outcomes are worse. Let's break it down. The U.S. ranks 40th in life expectancy, with an average of 77 years. Japan, which has universal health care, ranks first at 85 years. Infant mortality is shockingly high in the U.S., 5.4 deaths per 1,000 live births. Compare that to 3.2 in Sweden. In countries with universal systems, people with chronic conditions like diabetes or heart disease live longer, healthier lives because they don't skip medications or treatments due to cost. Meanwhile, in the U.S., 1 in 3 adults with chronic conditions avoids care to save money. The financial benefits of universal health care. Let's talk numbers. A universal system saves billions. Administrative costs alone in the U.S. are 8%, compared to just 2% in single-payer systems. That's because there's no need for billing departments or profit-driven insurance middlemen. Instead of paying premiums, co-pays, and deductibles, those costs would be rolled into taxes, and the average American would still save thousands of dollars every year. For example, a study by the nonpartisan Perry and Dem found that under a Medicare for All system, the average family would save $4,000 annually. Businesses would save $9,000 per employee by no longer paying for employer-sponsored insurance. And let's not forget the savings for our entire economy. Employers would no longer face the burden of negotiating insurance plans, and individuals wouldn't lose coverage if they switched jobs or retired early. The emotional and societal impact. Beyond the numbers, universal health care brings something priceless: peace of mind. No one should have to choose between paying rent and getting an MRI. No parent should have to skip a child's medication because of a $100 copay. Universal systems ensure that health care is there when you need it, without fear, without financial ruin. In the UK, a mother can take her sick child to the doctor without worrying about out-of-pocket costs. In Denmark, a cancer patient can focus on recovery, not bills. And in Taiwan, their single-payer system covers everything, from routine checkups to major surgeries, while costing just 6.6% of GDP. That's less than half of what the US spends. These systems aren't perfect. No system is, but they prove that it's possible to prioritize people over profits and deliver better outcomes. The dark reality of the for-profit system. Meanwhile, the US system continues to profit off human suffering. Let's revisit the numbers. Insurance CEOs earn tens of millions annually. For example, the CEO of United Health Group earned $142 million in 2021. Pharmaceutical companies mark up life-saving drugs by hundreds, even thousands of percent. A 2018 study found that Americans pay 344% more for medications than people in other developed nations. And the result? A 2022 study in The Lancet estimated that 338,000 deaths per year in the U.S. could have been prevented with the universal healthcare system. These are lives lost because care was too expensive or delayed. Addressing the myths. Critics often say universal healthcare means higher taxes, longer wait times, or government overreach. Let's break these down. Higher taxes. Yes, taxes would increase, but most people would save money overall. No premiums, no surprise bills, no crippling deductibles. Wait times. For non-urgent procedures, some countries do have longer waits. But for emergencies, universal systems prioritize care based on need, not ability to pay. Government overreach. The government already plays a role in healthcare through Medicare, Medicaid, and the VA. Expanding these programs to cover everyone is just logical. A vision for the future. Imagine a future where no one in America dies because they couldn't afford care, where families never face bankruptcy over medical bills, where everyone, rich or poor, can access the same high-quality care. That's the promise of universal health care. Countries like Canada, Japan, and Norway show us that it's possible to achieve better outcomes for less money. The question isn't whether America can afford universal health care. It's whether we can afford to keep this broken system. So what can you do? Start by sharing this video to spread awareness. Call your representatives and demand healthcare reform. Join advocacy groups pushing for Medicare for all or similar policies. Change begins with us. Thanks for watching. Don't forget to like, subscribe, and comment below with your thoughts on universal healthcare. Together, we can build a healthier, more equitable future for everyone.